A lot of movement last night and again today. They are wheeling and dealing to get doctors on board with overhauling health care. Democrats said to be working on a $250 billion deal with the medical community. That's the doctors in America, one that would freeze cuts in Medicare payments if doctors sign on to support insurance reform. Others think this is simply not the right move. Roll this. Bob Corker, Tennessee.
Now is engaged in basically selling the support of its body by leveraging, by throwing future generations under the bus, by, in essence, urging that we as Congress pass this week a $250 billion spending bill unpaid for. And if we would do that, we might get their support in health care reform.
All right, that was from the floor of the Senate yesterday. Dr. James Rohack, president of the American Medical Association, the AMA. Doctor, good morning to you and welcome back to our program. This is a bit of a pickle.
Good morning.
You know, you've got the AMA and you've got Democrats in Congress who need doctors to get with this health care reform in order to get reform passed. There will be hell to pay if doctors on board. How do you manage a $250 billion payment, though, Doctor?
Well, I think we need to be clear that the AMA wants to be sure that Medicare and TRICARE, our military families, have access to physicians. This problem started 7 years ago, and every 2 years we've been going to Congress. We told them you need to fix this problem, and Congress has been putting Band-Aids on it. And as a result of March 2005, Congress could have fixed this with less than $50 billion. Now it's up to $250 billion because of Congress's inaction over doing what they need to do, and that is
you understand
to
what we're faced with,
access.
right? I mean, this is a big Band-Aid that needs to go on this thing. Otherwise, you're going to keep on kicking it down the road. But if you put this into the health care reform bill, the price is going to balloon, on paper anyway, no matter the real-term reality. So, I mean, what it appears to be, they're going to put this in a separate bill and vote it through. Now, doctors are precious, and they are, like yourself, they are the most credible witnesses we have in this health care reform debate. When they come on TV and they tell us how they deal with patients every day, we listen to them. If doctors get the short end of the stick, the entire health care system pays a big price, Doc.
We agree. We agree that the doctors of America want to continue to take care of Medicare and TRICARE patients. Right now, the formula is broken. The formula penalizes doctors for keeping patients out of the hospital. It penalizes doctors for doing screening mammograms and colon examinations on patients. That's just a bad formula, and it needs to be fixed. Senate Bill 1776 by Senator Stabenow basically gets rid of this problem and says, okay, we can start with a zero baseline, not a 20% cut starting next year and a 40% cut through the next 6 years. And the reason the AMA is fighting for this is this predates all the discussions on health system reform. This is not new spending. This is an obligation that Congress made many years ago to make sure that they have access.
But to pay for it, whether it was 10 years ago or 10 years down the line, it's either higher taxes or it's deficit spending. I'll give you the last word, then I'm going to move on to the other side.
Well, again, we understand that the important thing is there's an obligation to Medicare and TRICARE beneficiaries that they have access to physicians. What we don't want to do is have a problem that's going to be created by Congress, who basically has health insurance. They're having their care paid by taxpayers, and they don't really understand the impact of their inaction over fixing this bill. And so we'll be watching as long as AARP too.
We all are. Doctor, thank you for your time. I'm going to get the other side right now. Steve Ellis with Taxpayers for Common Sense. Steve, the critical question is how you pay for it. I mean, is it higher taxes on some day? Is it more deficit spending? What's the answer?
You know, it's unclear exactly what the answer is. I mean, right now it certainly looks like they're talking deficit spending, but at the end of the day, it just needs to be paid for. This was essentially, it's been a gimmick for years of where, just like the doctor said from the AMA, is that essentially they would put a patch on it for a short period of time. That way they could assume revenues in the out years, which of course made it look a lot, the budget picture look a lot rosier, or at least a little less dark. And so now they're doing another gimmick. They want to sequester it away from the health care debate and say that this $250 billion, $245 billion expenditure has nothing to do with health care when it has everything to do with it. It's sort of like saying that you can meet your diet goals just as long as you don't count your rear end.
Cut that off and we're fine. Listen, you're in agreement with Dr. Rohack, though. I mentioned that you're from the other side, but not really. I mean, you're not against doctors either. The question is how you pay for it and how you do it responsibly, Steve.
Yeah, no, absolutely, absolutely. And that essentially you don't sort of, right now what they're trying to do is they think that they can get a bipartisan majority to support this Medicare doc fix just because who wants to be against doctors? And certainly the House has also said the same thing as long as they go along with pay-as-you-go rules. And so essentially, they want to do this separately so that it doesn't add to the bottom line of the health care fix when it's part and parcel of the whole package, and we should be looking at trying to pay for the whole thing.
So you're saying it's a shell game, right, Steve?
Yeah, no, absolutely. It's a sham. It's a budgetary gimmick to try to make something look a little bit smaller than it actually is. And $250 billion is real money to even to Congress.
Hey, listen, a year ago that would have rocked our socks off, wouldn't it? I mean, it's amazing to think how many zeros we've tacked on in just a year, right, Steve? Thank you for your time today, okay?
Take care.
Good to have you on. Steve Ellis, Taxpayers, Common Sense, Dr. James Rohack before that. They've got to figure it out. $250 billion, nothing to sneeze at, right?
Absolutely not.